One of the most common cancers among men.
Men are not as likely as women to consult, di ba?
Of course, we want to live with our family longer.
Good day, everyone. I'm Dr. Jing, and welcome back to MD in Focus, the show where we bring you valuable health tips and recommendations straight from our St. Luke's experts.
Welcome to MD in Focus. I'm Dr. Jing Zamora, and in today's episode, we are joining the global celebration of Father's Day and Men's Health Awareness Month. A perfect opportunity to focus on the men who mean so much to us, and more importantly, on an essential aspect of their health that is often overlooked, which is prostate health. Joining me in this discussion is our specialist, Dr. Francis Pile, head of the Stone and Prostate Treatment Center and a leading expert in urology and advanced minimally invasive surgery.
Hello, I am Dr. Francis John Pile. I am a urologist from St. Luke's Medical Center, Global City. I am presently the head of the Stone and Prostate Diseases Service.
Together, we will be discussing prostate health, the importance of early screening, and a major technological leap in treating prostate conditions, robotic-assisted laparoscopic prostatectomy. Hi, Dr. Francis. Thank you for joining us today.
Thank you for having me. Hello.
All right, Doc. So we have many questions for you in lieu of our discussion for Father's Day. The first one would be, what is the most common health concern among men in this day and age?
For men, age 50 and above, the concern here is the prostate health. So basically, when a man reaches the age of 50, it's about time for them to be checked, specifically the prostate.
So the magic number is 50. That's the time that they should be having this test. So what are these tests, doctor?
So basic tests to check the prostate would be a urine test, creatinine to check the kidney function, PSA, prostate-specific antigen, which is a screening for prostate cancer, and of course, basic imaging such as ultrasound of kidneys, urinary bladder, and prostate.
Is prostate cancer very common, doctor?
One of the most common cancers among men, it's really the leading cause. So that's the reason why we check the prostate of men age 50 and above to help us detect early if they have this kind of condition.
So doctor, what about the risk factors for prostate cancer or prostate disease? Are there many?
For prostate cancer, basically the risk factor is the genetics. So it's something that caused by genes. So for benign prostate conditions, it's just part of aging. It's normal for us men to have an enlarging prostate. For some men, it increases at a faster rate. For others, it's at a slower rate. But mind you, if someone has prostate cancer, you may not have any symptoms at all. And that's the reason why we need to encourage men age 50 and above to have their PSA checked.
What are the symptoms, doctor, of a prostate disease?
For enlarging prostate, you may have this difficulty in urination, such as frequency in urination, urgency in urination, prolonged urination, delayed initiation of urine, and the sensation of residual urine or incomplete bladder emptying. So now, when someone has prostate cancer, it doesn't automatically that you have these symptoms, because you may have a normal-sized prostate, but if you have prostate cancer, you may not experience these symptoms. So if you have prostate cancer, you may have no symptoms at all. And that's the reason, again, why we encourage patients 50 years and above to have themselves screened, so that if ever there's early detection, there's also chance for early treatment.
We all know that men are not as likely as women to consult, di ba? Yung busy with work, not very good yung health-seeking behavior. In general, that's what we notice. So I guess this is an eye-opener for our listeners, to have your spouses or partners checked, or at least encourage them to seek consult on their own, because hindi naman lahat with symptoms. Dr. Pile, in terms of management of these prostate diseases, how do we go about it when patients consult a urologist such as yourself?
So if, for example, the patient has undergone the basic tests, like for example, if the results come out that the PSA level is elevated, the next step for investigation is doing an MRI. With MRI imaging, we'll be able to detect if there's any lesion that needs to be biopsied. Now, if the patient has agreed to doing the biopsy and the biopsy turns out positive, that's when treatment options come. Of course, what we have at St. Luke's Medical Center is we have this robotic assisted radical prostatectomy that we can offer to patients who have early-stage prostate cancer. It's a very advanced treatment for prostate cancer, but it's minimally invasive, meaning you only need to have small incisions to get into the prostate and to remove the prostate cancer itself.
Doc, you mentioned several terms that our audience might want to get more knowledge about. You mentioned biopsy of the prostate. Is it something that is very invasive? Kasi usually takot po yung mga pasyente.
When we do the prostate biopsy, it's done under anesthesia, so the patient is comfortable. The patient will not really feel anything because these are very small puncture needle around the perineal area. So basically, it's a very minimally invasive test. Yeah.
And then the robotic surgery, do they expect incisions in their abdominal area?
Once the biopsy is confirmed to be positive for prostate cancer, the next step there will be staging the prostate cancer itself. So if it's a stage 1 prostate cancer, that's when we can offer this robotic-assisted radical prostatectomy. And what are the advantages of doing this procedure? Of course, since it's minimally invasive, meaning there are keyhole incisions, the patient has early time to recover. So he can resume his regular activities as soon as possible. Maybe in a week's time, they can already resume their activities.
How can we explain robotic surgery better to the family of the
Okay, how do we do the robotic-assisted radical prostatectomy? Of course, the patient is asleep, is under general anesthesia, but more important is how we approach the organ itself. No, the prostate gland is very deep under the pubic bone. So when we do the radical prostatectomy, it's a chance for us to get inside the prostate gland itself. It's like our hands are inside the abdomen, and with this very articulate small instruments, we can do the operation inside with the 3D magnification. So it's a chance for us to do those manipulations accurately, and of course, minimizing blood loss.
Dr. Pile, how has this robotic surgery changed the way patients undergo this procedure, their recovery?
Actually, it dramatically changed the concerns of having this procedure as compared to before when we do the traditional way of radical prostatectomy, which is an open approach. The recovery from robotic-assisted radical prostatectomy is quite early. No? So again, with an early recovery, patients can go back to work also at as soon as like in a week's time or 2 weeks' time. So that's how the robotic assisted radical prostatectomy has the advantage.
So it's really less pain,
Yeah.
shorter recovery time,
Correct.
and overall better quality of experience for the patient. Doc, what do they expect after surgery? Would there be any complications or things they should watch out for?
So what are the advantages of doing robotic-assisted radical prostatectomy? Well, doing this procedure, the negative surgical margin is increased, meaning we have more success in having a negative surgical margin. Secondly, in terms of erectile function, it is more preserved because the nerve bundles can be avoided during the procedure. And thirdly, it's the control of urination. No? So in doing robotic-assisted prostatectomy, the incidence of urinary incontinence is relatively lower.
This Father's Day, do you have any message for our fathers watching?
For all the fathers, of course, we want to live with our family longer. So it's part of being a father to be responsible by having your prostate checked. Again, once you reach 50 years old, it's better to have your prostate checked so as to determine whether there's a need for further investigation or treatment. It doesn't necessarily mean that If you have yourself checked, there's a corresponding treatment already.
So that brings us to the end of today's episode of MD in Focus. We hope that this discussion has helped shed light on prostate health and reinforce how modern advancements like robotic-assisted surgery are changing the landscape of recovery and patient care. Thank you, Dr. Francis Pile, for sharing your incredible insights and expertise with us today. And to all the fathers, grandfathers, and father figures out there, taking care of your health is the greatest gift you can give your family. If you or your loved one have questions about prostate screenings, do not hesitate to seek medical advice from a St. Luke's specialist. Thank you for joining us, and we look forward to seeing you in our next episode of MD in Focus.